Hello. Hope my audio is clear. Yes. Can anybody respond in the chat box? Okay, fine. So, just we will wait for some 2 minutes. Okay, and we will start. Okay. So, um, myself, Nitin Krishnan, I have completed my graduation from Tirunelveli Medical College, and I belong to 2018 batch. So today I would like to discuss about how you have to approach third year, because you are following a new curriculum, and in that new curriculum, final year, okay, in final year we are having much more subjects to manage. So today I will focus my discussion into three parts. Okay, it is maximum a 30 to 40 minute session. In the first part I will be talking about how to manage third year subjects along with the clinical postings of the final year subjects that you will be doing in your college. Second part, I will be telling how to cover or how to start preparing for your postgraduate competitive exams, NEET PG or INICT from third year itself. Third thing, is it necessary to buy some app like Maro, Prepladder or whatever it may be, or can we prepare for PG by textbooks? So these are the three parts that I am going to answer today. So first of all, part one, you have two important subjects. One is forensic medicine and toxicology, and second is community medicine. So I have already told in the book list video, you have to follow Park for community medicine, and you have to follow Ignatius, which is a better textbook, which is easy to read, comprehend, and reproduce in the exam. And Reddy is a standard textbook. You can have the PDF for reference. So, as far as community medicine Park is concerned, see, Park is it's like a storybook. The examiner explains everything that he feels. Okay. For example, let us take a topic called tuberculosis or HIV. The examiner tries to deliver whatever he knows through that book. So that is why it looks so elaborate for us, and we have to read and we have to pick up the points, then only we can write them during the exam. So that is the first thing. Second thing, unlike other textbooks which are more colorful, okay, with lot of images, Park is, it's like almost like watching a black and white film which was released some 60, 70 years back. So you will feel bored, you will feel sleepy while reading the Park textbook. Okay, let us keep these two things aside. Let us see how we can solve this issue. First of all, start reading with some interest. Okay, it's all your mindset. Okay, I have to read this textbook somehow because I have to crack or I have to pass my university exam. So I have to read it. And all the departments in Tamil Nadu, okay, community medicine department, they will emphasize you to read Park some way or the other during your posting for your internal exams. Of course, in university exams also, all the questions they are asking from the Park. What I want to say before you go to start reading the Park textbook is, rather than reading line by line, try to understand what the author wants to say. For example, tuberculosis means you should know at the end of reading that chapter, you should know, okay, what is tuberculosis? Why I am reading tuberculosis from in community medicine? What is the role of doctors in the prevention of community medicine? Sorry, ATB in our community. Okay, what are the different levels of prevention? What are the drugs? So all those. What I will advise is, see, the bulk of the textbook in Park is composed of communicable diseases. And these communicable diseases, you would have already covered everything top to bottom till diagnosis and treatment from your microbiology textbook in second year. What I will advise is, except the prevention or the community medicine part, rest everything you can read from your microbiology textbook, which will be very easy. Once you open the chapter communicable diseases, you will understand that everything that you have read from your microbiology, the examiner has, the author has what repeated in the Park textbook. So those things, please read from the microbiology textbook and read it here. So PSM is preventive and social medicine. How we are going to prevent the diseases. What are the strategies initiated by the government? What are the health programs, and how these health programs is going to be benefited by the public? So these are the things which is actually the core of public health, so-called as a PS. So while reading the Park textbook, read such salient points, read such headings, read such bold letters, and don't waste your time reading line by hearting them. Understand, okay, this is the content, this is what it happens. So understanding will help you to save time, and of course you have no other option, you have to read Park textbook, because then only you can go ahead with the third year. Okay, you have tried your best, you can't read Park, then go for some exam preparatory manuals in community medicine. Okay, there are a lot of Indian authors who are well versed with this Park, and they have made something like a notes from the Park. Okay, that is called as exam preparatory manual. There are, of course, one which I would like to mention is Vivek Jain. Okay, Vivek Jain, he's a national level faculty for community medicine. Okay, and so what I will suggest is you can go for him. Okay, you can see his exam preparatory manual and you can understand. Okay, and if you keep those things in your mind itself, you can manage your exam. Coming to forensic medicine. Forensic medicine is again like memorizing lot of things. Okay, forensic surgeon, so called as the police surgeon, they are concerned with what? They are like an investigators. Okay, they will find the cause of the death. They will go behind the cases and they will find the cause of the death. Here also try to understand, okay, what is happening, what is postmortem, what are the different types of autopsy, why we should study toxicology, what are the different poisons, what are the clinical presentation of different types of poisoning. Understand and study. Ignatius is a really very good textbook, lot of colorful pictures, okay, and it is very easily digestible also. Okay, unlike Reddy, where you have to, again, Reddy is like Park. Okay, you have to read, you have to find the points, you have to summarize, then you have to revise it again, then only you can write in the exam. Whereas in case of Ignatius, it is a very wonderful textbook, so you can go for Ignatius. And Vision, I told, it is just like a hint, it is like a notes. Okay, just okay, organophosphorus poisoning means some 10 points will be there. Okay, nothing right. Why is it so, why it happens, no reason, just 10 points. Okay, that is actually called as it is like watching a trailer of the movie. Okay, it is like watching the trailer of the movie. Okay, you know what is it. Okay, you know, okay, what is OPC. Okay, if somebody asks you, okay, what happens in the film, you will say, okay, this is actually the film. Okay, But when somebody asks you, okay, what happens after this incident? What happens in the first half? What happens in the second half? If somebody asks what go on scrutinizing about these statements, you can't answer. So that is actually vision. So vision is just like watching a trailer of a movie. Whereas studying from a textbook like Ignatius is like from the first scene to the last scene, the climax, everything, all the songs, all the reactions, everything you will be well versed. Okay, that is Ignatius textbook. Okay, so go for this. And then comes clinical postings. So in the third year itself, you will attend medicine, surgery, OBGY, pediatrics, orthopedics, dermatology, psychiatry, all the clinical subjects posting. Actually, these subjects are very important in your final year. But in third year itself, your department will give you posting order to attend some particular days and let it be like 15 to 30 days in these departments. So what I would suggest is try to observe. Observation is a skill that you have to develop over a period of time. You can't develop this skill by watching some videos, pre-recorded lectures or YouTube videos or nothing. You have to sit or stand near the patient. You have to observe what is happening with the patient, what made the patient to come to our government hospital or our college. Okay, you have to observe. That observation skill will take you to a different level, because this is a clinical skill, and a clinical knowledge will, it's like what okay, getting a degree with a good theoretical knowledge is like making a good chicken 65. But at the same time, if you just do some special masala, okay, if you just decorate it, if you present it very well, the customer will be will be very happy. So the same thing here, you should have good theoretical knowledge. At the same time, you should develop this observation skill. Then only you can shine well in our profession. So what I will suggest is, during all these clinical postings, you study only the clinical textbook in the third year. What are the clinical textbook? Hutchison is the standard. Hutchison and McLeod are the two standard textbooks you can follow for medicine. Clinical DAS for surgery. Orthopedics also DAS. OBGY, some used to read Hepzibah. Okay, Hepzibah, she's again from Tamil Nadu only. Okay, and pediatrics, Aruchami Lakshmanasamy. Okay, these are the practical textbooks that you can follow for the pre-final year. It is not necessary that you have to buy the hard copy, but if the department emphasize you to buy, you have to, or else you can see the PDF also. Study the basics. You would have studied what is pulse, what is JVP. But in medicine posting, you will be seeing the live patient who have some pulse abnormalities, JVP abnormalities, low BP, high BP. So you are applying everything. Okay, all the basics you have studied in the first and second year, and from third year and final year, you're going to apply. You are going to visualize in reality. So at that time, you should be very confident. When the patient asks you something, sir, why I am having this abnormal pulse, you should very boldly say you are having this disease, that is why you are having this abnormal pulse. For that boldness, you should be thorough at the basics. For example, you are ausculting in a patient of mitral stenosis, and you found that the patient's pulse is irregularly irregular. You are suspecting atrial fibrillation in that patient. You should know how a normal pulse is. You would have forgotten, you have studied normal pulse, waveforms, everything in the first year physiology. What you have to do that day, go back, open your physiology textbook, see what is the normal pulse, what is normal JVP, how to measure normal blood pressure, what are the normal variants of pulse, abnormal variants of pulse. Everything you have to go back and read. This clinical textbook which I have mentioned will help you to have a proper in-depth understanding of examination, history taking, and of course it will also help you to strengthen the basics. But the basics and all, they will just mention like hint. In Hutchison they will like, okay, these are the different types of pulse. In detail, if you want to study about the pulse, you have to go back to your first and second year textbooks, read from those, and come back and attend the next day clinical postings. So in third year, don't think that okay, you just have forensic medicine and FM. No, you have to think that okay, you are in final year already, and give prior importance to the clinical posting. Attend the clinical posting. All cases, learn the history taking, then clinical examination, how to measure JVP, how to take proper pulse, okay, how to do an examination in CBS, RS, how to do an obstetrical examination, neonatal exam, everything, all postings, you should study the basics. If you couldn't understand the basics, or if you couldn't recollect the basics, no problem. Don't go down. Go to the room and start reading from the first. That is, take your anatomy, the exam. Okay, in orthopedics, no, the orthopedics professor will be asking, okay, what nerve is injured in the radial fracture? What nerve is injured in the surgical neck of the humerus fracture? You will forget. You know axillary nerve, radial nerve, anatomy, structure, pathway, cause, relation, everything you have well versed, and you have got wonderful marks in the first year. But the problem is you forgot. It happens. Okay, so don't feel bad that okay I have forgotten. Go back and read those. Okay, you can see your textbooks or through some other ways which I will mention later. So this is how you have to take your final year posting. Don't think that it is just a time pass. Coming to ophthalmology and ENT, even though it is now introduced in your final year, what I will suggest is ophthalmology and ENT. Buy textbook of A.K. Khurana and Dhingra for opthal and ENT. Start reading from one side. You don't need anybody's support. Okay, don't expect that okay the professors will be teaching and after that you can study. No, that and all maximum up to second year. From third year and finally it's all our effort. Go to YouTube, see any videos, okay, see any good faculty's lectures, understand what is happening in ophthalmology, what is happening in ENT, okay, try to understand your best, okay. In ophthalmology and ENT posting, try to apply it in your patient, study the questions. So ophthalmology and ENT, earlier it was in third year, okay, for my batch and all. So we managed ophthalmology, ENT and community medicine, all three subjects. Like that, you also do this in this year. Ophthalmology and ENT, see the university question bank, see the question papers, start preparing. Start preparing. So at the end of third year, finish ophthalmology, ENT, SPM and FMT. 4 subjects, you finish it. This is what you have to do actually. Okay. So till this, you got an idea how to start? Yes? Can somebody respond in the chat box if you don't mind? Yes? Can anybody respond? Okay. Okay, fine. So this is how you have to see the third year subjects and final year subjects. Then coming to your second part, okay, which is regarding your NEET PG or INICT preparation. See, NEET PG and INICT preparation, it is all rather than saying that hard work, I will say it as like a smart work because you will be reading the textbook, right? For example, Robbins or Apurva Shastri or K.D. Tripathi, whatever textbooks in your second year, first year, Chaurashi or Vikram Singh, whatever textbooks. So textbooks is in detail because reading textbooks will help you to understand what is going on with the subject because you don't have any idea, right? When you enter the first day of your medical college, you don't know what is anatomy, what is physiology, what is biochemistry. So so at that point, when you see the textbook will take you from the alphabets ABCD to the highest level. But when it comes to competitive exam, you should know certain things up to the mark. There are certain things you can ignore. There are certain things which you should be well versed. In-depth knowledge is needed. So, what to say? There is a proper way in which you have to approach each and every subject because you have 200 questions. You have 19 subjects. So per subject you will get maximum like let it say like as far as first and second year subjects are concerned, 5 to 6 questions from a single subject. Anatomy 5 or 6 questions. Okay, physiology is 3 or 4, sometimes 6 or 7, like that. It is vary from year to year. There is no fixed weightage of subjects in final year. Okay, I mean you need PG or INICT. It varies from year to year, but final year subjects are more important. Okay, final year all subjects are important. Community medicine is extremely important. Okay, but you don't know When you read the Park textbook, when you read the major or standard textbook, you don't know what topic you have to focus, what extra I have to read beyond the textbook. So you have lot of things, because in NEET PG exam there is no syllabus. They can ask anything. They can ask an MD/MS level question. They can ask a very basic question, very simple question, onliner, name the following type of question, true or false question, to clinically oriented case scenarios, very tough, highly advanced question. So you can't you don't have an idea of how to approach such things. So for that, that is the reason why everybody start subscribing to or platforms like Marrow, Prep Ladder, and all other things. The same I am telling you, I have started using Marrow from my third year only. And in this INICT, I got an all India rank of 1554. But that is very late. Why? Because I started preparing late. I started my preparation from final year only. That's why I am advising you to start your preparation earlier so that you can crack in your first attempt. In my first attempt, I got a rank of 14,000. Remember, there are students in our country, especially North India and all, who got first rank, second rank in their first attempt itself. Why? Because they started preparing from their second year and third year very sincerely for this competitive exam. When we prepare only, we will get the result, right? Without hard work, we won't get anything free of cost in this world. So, from third year is the best time, because first and second year have already covered, and that's why I call third year as a transition phase for everything. Whether transition phase to the final year, transition phase for the competitive exams, whatever it may be. Because you have basics and you are in a phase or in transition to the clinics. And this is the best time to integrate both and prepare at your best. You can use such platforms. I preferably use, I will say, like Marrow. Why? Because the question bank is good, faculties are good. Okay, everything is systematically planned and presented within the that platform. So there are a lot of advantages for that. So that is why I personally prefer to go with Marrow. Okay, the choice is yours. You can choose what you have to go for. Okay, the choice varies from person to person. So that's your part. But once you use this platform, whatever it may be, you will get an idea in anatomy what all I have to focus, because studying is different, solving MCQs is different. In your exam, you are going to get multiple choice question. In that, how to get within 30 seconds you will get for a question. In 30 seconds, how to answer such a big question, easy question, moderate question, or hard question. You have to practice multiple choice question. What type of questions? There are audio based, video based question, multiple answer type question, assertion, reason type of question. Okay, different types of questions are there. So these platforms will guide you in each subject what all you have to concentrate through videos. Okay, there are a lot of video lectures. You can start watching. If you are in third year, you can first watch the third year subject FM and SPM of the END. Along with that, when you attend your clinical final year subject posting, you can go back to your anatomy, physiology, and you can start watching the videos, understand and strengthen the concept. In your university exam, you would have read only the important questions. Radial nerve is an essay you will study. But in PG exam, they will ask about musculocutaneous nerve. Musculocutaneous nerve is not an essay. You would not given that much importance to musculocutaneous nerve, but you would have studied radial nerve. So in NEET PG, there is nothing like competitive exam. There is nothing like the most important, less important. No, they will ask anything they feel. So these videos will help you to focus on the concept. In university exam, you would have mugged up by heart a lot of things. In PG, you can't by heart. Till what limit you will by heart? You have around 19 subjects. There is a limit even to mug up, right? You can't do that, because the same question is not going to be asked next year. Different question from different topic. Imagine, 3 volumes of Chaurashya you would have studied in anatomy. From the 3 volumes, you are going to ask just 4 or 5 questions in NEET PG exam. Can you guess even what 4 or 5 questions that will be? No. So these videos will help you, or these platforms will help you to start your preparation in a proper, systematic, planned manner. Or each word I am stressing because that much it is important. Once you see the videos, understand what the concept, you can solve any level of question. And after that videos watching, next step is to accelerate yourself in solving MCQs. In 30 seconds, how many questions? 1 second, 1 minute, how many questions? So all that skill you have to slowly develop. Okay, so that is the reason why everybody is stressing to go with that platforms, so that you will get a well organized strategy. Next comes the question, sir, how to read the textbook and how to see this. All the platforms are videos are made in such a way that you can manage your university exams also with those videos. In final year, I only watched Marrow, and with Marrow only I managed to get very good marks in all the final year subjects. Practical also. Practical, of course, you have to read from the practical textbooks, postings, everything. That is a different part that you won't get from these videos. That you have to observe, see the patient, examine, then only you can learn those skills. If you are going to go with the platforms, believe that those notes, those videos, those content is more than enough for you to get a pass mark in the university exam. The same thing only, what is given in the textbook, in videos, they are presenting in a different, concise, very easily manner so that you can digest or comprehend in a very short period of time. It will take you 3 hours to read 30 pages in Park. The same 30 pages will be given in the form of a single 15-20 lines in through these videos, because they are made by the faculties who are having damn experience in this what subjects. Some 20-25 years they will be teaching community medicine, so they know what is the topic that author is staying in the standard textbook. And remember, all those faculties who are teaching in these platforms, they studied much higher standard textbook than what we are reading, and from all those textbooks they are summarizing their content and they are presenting in front of you, so you can very confidently trust them and go with them. Okay, so these are the 3 different parts I thought of discussing today. Give importance to your third year subject. See the clinical posting very seriously. Don't think that you are going there for some time pass. Okay, develop good observation skill, good clinical skills. Then if you want to crack the competitive exams in lesser attempts, okay, lesser number of attempts, do take this seriously. Take the help of some platforms or something else. Okay, if you feel like, okay, I are having some financial issues, I will suggest one way, like, most of the platforms you can use in up to two devices, I think. So you and your friend can share the amount and you can get an account and you can share among yourself and you can use it. So these are the various things that students are doing in our colleges. So that's what I told you, if you are thinking like that way. Okay, so you can do that also. Okay, for example, in Marrow, I think 2 or 3 devices maximum you can use. 2 or 3 students of you. Okay, for example, if your roommate is studying early morning, you can study night and you can ask your roommate to study in the early morning. Okay, fine, you can share the account. Okay, if you are thinking about that, yeah, there are many students, yeah, I know in our college who have been doing that, but finally they are studying. So somehow you find a way to study in a proper manner. That's it. That proper systematic manner is very important. Studying randomly something, okay, reading a lot, it's not the rule for competitive exams. In competitive exams, smart strategy. What to read, how to be well versed. No excuses. You can't say I read Park line by line, but I made all questions wrong in community medicine in EPG. What does it mean? It has no meaning, right? Yeah, but at the same time, you just read, okay, what is important. I answered all questions correct in PG exam. That made sense. Finally, it's your journey, it's your life, your career. So you have to take certain decisions at the right time. I have taken that decision in final year. I'm making you to take that decision a bit earlier in your pre-final year, so that you can prepare. You will get 1 more year. 1 more year means that 1 year, no, after your internship you can save sometimes. So start early, prepare properly. No doubt you can crack the competitive exam. It's not like impossible, it's not like a mission impossible thing. It is possible for everybody, but you have to but do things properly in a systematic manner. Okay, so yeah, that's it. So the 3 parts which I want to discuss, I have discussed it in this session. Hope this is useful for you all. Yes, can we wind up the session? Please, anybody, can you please respond in the chat box? Yes, if at least one of you respond means I will wind up this session. Yes, if at least one of you respond means I will wind up this session. Okay, so thank you so much for the people who has attended this session. Okay, if you have any doubts regarding the preparation strategy or anything, you can feel free to message me. Thank you.